Thank you. In December 2015, Storm Desmond hit the UK, causing widespread devastation. In Cumbria alone, more than 5,500 homes and 1,000 businesses were flooded, tearing people's lives apart. And nearly 800 bridges were damaged or destroyed, making it really difficult to even travel around the county. Cumbria declared a major incident. National Government's Cobra Committee was meeting. And that response phase lasted for nearly a week. And it was followed by many months of intense activity to support the county's recovery. And we're still seeing some impacts of Storm Desmond now. Certainly, whenever I talk about the flooding that was caused, I find people want to tell me their stories about it. And it often seems as though almost no one in Cumbria was completely unaffected. So my personal involvement in Storm Desmond started as a mountain rescue volunteer. I wasn't up to my waist in floodwater, like these three on Cockermouth Main Street, but I was sat in police headquarters, trying to tie together the information on two different logging systems and make sure the work of the organisations was as joined up as it could be. And my involvement continued into recovery through my work at Cumbria CVS. I was employed as the coordinator for Cumbria Third Sector Network, and as such, I became one of the main links between the formal recovery structures and Cumbria's voluntary and community organisations. Now, you're probably wondering what on earth this has to do with improving local health services. And that's about all I'm going to say about flooding, because what I want to talk about today is how my experiences in Storm Desmond have affected how we approach collaborative working. Because I think, despite the fact that I'd been employed in Cumbria's third sector for nearly a decade at the time of Storm Desmond, and I'd spent all of that time in partnership roles, this one event has had more impact on how we approach that work than almost anything else. And I don't think I was the only person to feel that way, because it wasn't long. In fact, it was only a couple of weeks before people started saying, well, we all work together really well in an emergency. How can we make that happen the rest of the time? And that was a question that filled me with horror. For the first few months, it filled me with horror simply because we were still working absolutely flat out on recovery, and we hadn't had any opportunity to take a step back and to reflect on what was making it work. But even a year on, it filled me with horror. And then it was because there are just so many things that make it easier to collaborate and to get things done in the middle of a major incident. But we're nearly 4 years on now, and I think we have managed to pull out some learning and to use it to adapt how we work. And that's really what I want to talk about today. So I think the first thing that's changed for me is I'm much more aware of just how scary collaborative working is. And I'm certainly much more willing to say that. It's scary walking into another organisation where you don't know anybody. And it's particularly scary walking into a big public sector organisation when you're a volunteer and you're not really sure you're supposed to be there in the first place. But I think during flood recovery, what was different was I spent a huge amount of time working very closely with senior people from our public sector organisations. And that's really different to working with those same people once every few months in a big partnership meeting. It's really hard to keep up that front of cool, calm professionalism when you've been going flat out for 3 weeks with next to no sleep. I certainly couldn't do it, and lots of other people couldn't too. And so I think what became much clearer to me in Storm Desmond was that actually everybody finds it a bit scary, albeit for different reasons, but also everybody was working really hard to do the best things for local communities. And I think that's worth reflecting on for a while, because that commitment to do the right thing can often get a bit lost behind the need to look professional, they need to be fair, and all those layers of rules and regulations that get in the way of things. But it's important that we look at ways to try and refine that connection, because once you've built up that trust about people's motivations, it's much easier to work together collaboratively. Now, one of the reasons it can all be a bit scary is it feels like you're breaking all the rules. That's almost inevitable when you're doing partnership working, because when you've got 2, 3, 4, several hundred organisations trying to work together, everybody's rules are a bit different. There's going to have to be a bit of give and take to get around them, a bit of bending of the rules, shall we say, even if we don't break them. And once again, that's scary. It makes people feel vulnerable. But if you can find ways to build the relationship and build trust between people, it all gets a bit easier. And I think we realised that that's what we'd begun to lose in some of our partnership working, was the time and the capacity to maintain all those relationships with our partner organisations. And so since Storm Desmond, we've managed to create a number of new partnership posts that have tried to put that back into the system. And one of those new partnership posts is our now rather famous hippo. She's sat in the audience. It's Claire, who's our Health Partnerships Officer. And you might well be wondering how on earth she ended up called the hippo. You obviously are. My colleague Josie and I were getting a bit frustrated trying to put together the person specification for the role. And that's because we knew there was a set of skills and behaviours that we needed for collaborative working, but they weren't the kind of skills and behaviours that organisations traditionally recruit people for. They weren't those sort of management skills we train everyone for. And that meant we couldn't find them written down anywhere to nick and put into our person spec. And in the middle of this frustration, we suddenly realised that if we renamed the Health Partnerships Officer post to be the Health Improvement Partnerships Project Officer, it'd have a much more memorable acronym. We didn't dare quite rename the post, but unfortunately for Claire, the nickname has rather stuck. So what I'd like to do is have a look at some of the skills we were trying to get down into that person spec. The first of those was an ability to talk to anyone from a service user to the chief executive, the local MP, the staff and volunteers of a local community group, pretty much anyone you can think of. But it's not really about the ability to talk to anyone. It's much more the ability to start a conversation and then to listen to anyone, and to listen really well and begin to understand what's important to them and what's blocking things from working at the moment. And then they need to know their stuff. And by that I mean they need to understand what the context they're working in, what the regulations are, what the policy context is, and what's constraining organisations to behave the way they are at the moment. But they also need to understand what's important to communities and to users. And I think those two things together let you think across the whole system. They give you the ability to spot what's important to users, what's important to communities, but also to see what you could change at a strategic level to make it more likely that things will work smoothly. I think it's really important that people see themselves as connectors, trying to make relationships between other people, rather than seeing themselves as a gatekeeper and trying to funnel everything through them. And then somewhere in there, they need the time to do some real work. Not just the time to build relationships with other people, but the time to put in place some of the systems and processes that will keep that kind of working going in the long term. And so there is a place in there for those more traditional management skills. It's not all about the nice, warm, fluffy stuff. And then we thought there were a couple of much more general skills that were really important. One of those was the ability to be comfortable with chaos, because collaborative working is usually a bit messy. It doesn't fit nicely into an action plan full of smart objectives. And not everybody's very happy working in that way. And it's important that you're resilient, which is possibly one of the most overused words at the moment. But what I mean is that on a good day, working in a partnership post's fantastic. When it all comes together and it's all going well, everybody thinks you're wonderful. But the reality is those good days are pretty few and far between. Most of the time, you're pushing up against things, you're challenging people, you're trying to make changes, and actually everyone thinks it's all your fault. So it helps to be determined, although if I'm talking about myself rather than Claire or any other staff, I tend to simply say stubborn, sometimes to the point of pig-headed. But that's not always a bad thing, because I think what you see when you're trying to make changes across an organisation is that everybody loves a nice, contained, innovative pilot project. But once your pilot project starts to become more popular and starts to spread, people start coming up with reasons why it won't work, particularly when it starts to change how they're going to have to behave on a day-to-day basis. And that's often described as the organisation's immune system fighting back. Now, I think the important thing from that is just to remember that leading system change is really hard work. It's a bit unfair to put all of that onto one person, or even one hippo, even though hippos are quite big. And so as we've designed the partnership posts, we've tried really hard to make sure that we've put support structures in place around them. And that's usually been putting together a steering group for the project. That steering group has had really senior input. So the steering group for the hippo has got director level input from our local NHS. And that's meant when we've been pushing against all of that system change and all that pushback, we've still had some reassurance that actually we're still pushing in the right direction. And it's provided us with a mechanism to troubleshoot some of the problems that come up, and where the best solution to those problems has just on occasion been to have a bit of a kick from above. We've had a way to do that. But I think perhaps the most important thing about those steering groups is it's given us a huge amount of flexibility in how we can run the projects. So although we've had a really clear vision of what we're trying to achieve and some idea of the outcomes we want, we've managed to avoid having to write down too many particular activities and too many outputs at the start of a 2-year project. We've been able to work through that steering group to manage the project and adapt it as we go. So I think, first of all, I need to do a thank you to all the organisations who've supported us in that. Our trustees at Cumbria CVS, who've taken the risk of working this way and employing lots of the partnership staff, and to some of our partner organisations who've either funded us or worked in partnership with us. So the Lottery, Cumbria Community Foundation, Cumbria County Council and the North Cumbria NHS. But in reality, it's very rarely just about finding the right organisations to work with. It usually comes down to finding the right people within those organisations. Certainly, the people who are prepared to throw away that safety blanket of nice, neat action plans full of KPIs, and prepared to take a bit of a risk to try to do things differently because they think that collaboration is going to make things better for people. And whilst those people need to be determined, they also tend to be people who can add a bit of magic and a bit of sparkle so that things stay fun when it all gets tough. And I've had the opportunity to work with some amazing people over the last few years. And some of those people have also become the most incredible friends. So to finish, I think it comes back to that message that we need to be hard on the problems. There's plenty of stuff that we need to bash our way through or sometimes wiggle our way around in order to change services and to make them better for people. But doing that rarely depends just on making changes to the system. It usually depends on finding the right people to make that happen. So by all means be hard on the problems, but also remember to be kind to the people. Thank you.